Hello everyone. In this video, we are going to continue the discussion on perspiration. So in the previous video, we have introduced some of some types of the perspiration, such as with or without sweating. And in the last video, we also introduced the spontaneous sweating or night sweats. So from spontaneous sweating and night sweats, don't only understand from the name, because it doesn't mean the night sweat doesn't mean that it happens at night as only. Spontaneous sweating is also leads to the line between spontaneous and night sweat is the person while they're sweating, the person is awake or not. Doesn't mean the spontaneous sweating only happens during the day and night sweats only happens at night. So that's not the definition is not only from the title, then the name of the terms. It is actually refers to the sweating the patient is awake or while sleeping. So don't misunderstood these two terms. So here we begin to continue the different types of other sweating. The persistent excessive sweating in critical conditions. This often refers to depletion of yang or yin. You still remember what's the depletion of yang or yin, or in other words, collapse of yang qi or collapse of yin qi. So what's the cause of the collapse or depletion of yang qi? So this means the yang qi the body loses the yang qi in very short time. What can cause this, such as severe bleeding or some other medical conditions cause yang deficiency? Patient with yang depletion presents with dripping cold sweat, a pale complexion, cold lumps, and an extremely faint pulse. So from the pulse is weak, and the sweat, when you feel the sweat, you can feel the sweat is cold, and the face color also pale. The patient's hands and feet are cold. So these can indicate the collapse of yang qi. Patient with yin depletion presents with oily, sticky sweat, restlessness, thirst, and a sweaty, rapid or swift pulse. So when we study the pulse, you will understand what's the sweaty, rapid pulse. From here, you only need to understand the sweat, the manifestation of the sweat are different from these two. One is the cold sweat, the other one is oily, sticky sweat. What does it mean by oily, sticky sweat? It actually refers to the manifestation of the sweat is stay on the skin like the oil, very sticky. So the cold sweat or the sweat, our normal sweat, once it goes out from the pulse, it will drop. But those kinds of oily, sticky sweat, they will stay on the skin and keep there. And the patient also will be restlessness. So the patient irritates first. So these two types of sweating are actually in critical conditions. So in the clinical practice, sometimes it's not easy to see these kinds of situations. Also in In other words, if you see these kinds of sweating, it's in severe condition. For the young collapse, those kinds of sweating, sometimes you can see in some situations, such as in low blood sugar. The patient have palpitation, have sweat a lot, and also cold sweat. So in this situation, you also can consider it not has to be, but sometimes it also considered as the yang depletion. So in this situation, the patient keeps sweating, they losing yang qi. It's very important to keep yang qi in the body, to restore the yang qi in the body. So these two sweats, when you see these two kinds of sweats, you will know that this is actually in critical conditions. You need to be careful when you see patients in this situation. Why they keep sweating? The sweat never stop. So we need to be careful. The reason for these two kinds of sweats for yang depletion is a collapse of yang qi, which means why the patient presents with sweat. That's because the patient loses yang qi, and because of the patient cause yang qi deficiency, so the yang qi in the body cannot hold the body fluids in the body. That's why the patient got excessive sweat. This is because of the function, which function of the qi, which function of the qi can hold the sweat. That's the confining function of qi. So if you don't remember here, go back to the basic theories in the session axons, qi, body fluid last session. We have discussed the functions of the qi. So that's the yang depletion. That's because of yang qi deficiency. The yang qi could not hold the sweat, the body fluid in the body. The yin depletion. Why the patient will have sweat in yin depletion condition? So yin depletion means the patient got a collapse of yin qi. They don't have enough yin qi in the body. In this situation, the patient will have relatively excess yang, right? That's the situation we have discussed before, the balance of yin and yang. Once they got yin deficiency, the patient may have relative yang. Relatively young doesn't mean the patient will have excess yang, but this amount of yang qi compared with the yin that's excess. This excess yang qi is a kind of heat. That's why we said internal heat, forcing exhausted yin fluid outward. That's why the patient will have sweat. The internal heat force the body fluid to come out. So in this situation, because of this condition is due to yin depletion, which means the patient have yin deficiency. But in the meantime, because of the yin deficiency, the patient will have internal heat, and the internal heat will cause sweating. And this kind of sweating will make the yin deficiency worse. So here is actually similar to a vicious circle. The more yin depletion, the more internal heat, and the patient will have more sweat. The more the patient sweats, the more yin depletion. So this is actually in very severe situation. The next one, shivering and sweating. This refers to a cycle of sudden coldness followed by shivering and sweat. So this patient, they can feel aversion to cold. They have a sensation of coldness, and then after the coldness, they feel shivering and don't sweat. So this is the process of this kinds of situation, or these terms of shivering and sweating. It's often seen in a fierce struggle between healthy qi and pathogenic factors in cold damage condition, and regarded as a turning point of prognosis. The cold damage condition is actually another way to say the cold attack. The coldness, the pathogen of coldness. The patient is attacked by the coldness, and the result of the sweating. After the shivering and after the sweating, if the fever resolved, so the fever recovered and the body temperature goes back to normal. Also from the pulse, moderate pulse indicates a favorable prognosis with healthy qi prevails over pathogenic qi. This is actually just means that if the fever recovered and the pulse is not violent, it's actually we can see the patient is recovering. Whenever unresolved fever, which means after the shivering and sweating, the patient still have fever and the pulse may be swift or steady or rapid. That indicates a critical condition of the pathogenic factors prevailing over healthy qi. The reason why we have this kind of conclusion is actually we need to think about the cause of shivering and sweating. The shivering and sweating is actually the struggle between the healthy qi and pathogenic qi. So if the healthy qi wins, which means the pathogenic qi or the pathogenic factors in the body will be reduced. That's why you can see that the patient is recovering because the healthy qi wins. If after the shivering, or in other words, after the struggle between the healthy qi and pathogenic qi, and after sweating, the patient still have a fever, which means the pathogenic qi wins. That's why it can develop into a critical condition. And in this situation, we can see that the pathogenic factors prevails, and the healthy qi is actually kind of deficiency because the healthy qi lose. Apart from these kinds of different types, there's also another two, such as another three types, such as the cold sweat. Cold sweat refers to the sweating that the patient can feel the coldness, or when they feel the sweat, they feel the fluid, they have a kind of feeling coldness. And the hot sweat refers to the patient when they sweat, they can feel the hot feeling, and this is due to the internal heat. For the cold sweat, that's due to internal cold. What's the internal cold? What's the cause of the internal cold? The internal coldness, that's actually due to yang deficiency. Also, this kind of sweating, the cold sweating, also can happen after fear. So if the patient is scared, they can sweat, and this kind of sweat also can feel coldness. The last types of sweating we are going to mention is the sweat with yellow color. What kind of sweat will have yellow color? Or how do you know the sweat with yellow color? The patient can see that from their clothes, especially from the light color clothes after sweat, especially when the sweat comes and goes for a certain period. The patient can see their clothes. Their clothes were dyed into yellow color. So this kind of yellow sweat is due to the wind heat or wind dampness with heat. So these are different types of sweat. Apart from these different types of sweat, we also need to talk about the location. So different location of the sweat can indicate different situations, such as sometimes the patient have the sweat on the head only, or sometimes they have sweat on parts of their body. What do these symptoms mean? So the next topic we begin to talk about is localized perspiration. Perspiration in localized body parts can be diagnosed into deficiency, excess, cold, and heat. So this is actually every perspiration, all kinds of sweating can be diagnosed into deficiency, excess, cold, and heat or hot. So the first one, if the patient sweats on the head or the neck, so the patient will tell you that when they sweat, mostly localized in the head, and sometimes they will tell you that when they sleep, they can see that the pillow was wet. The sweat can wet the pillow. So what happens to here? From here, we need to think about that from the theories, the head and the neck is the upper part of the body. Which pathogen can go to the upper part of the body? That's a yang pathogen. So for this kind of situation, the pathogens, no matter it can be combinations of different pathogens, there must be heat, there must be fire there. That's why we said the contributing factors include excess heat in upper jaw, damp heat accumulating in the middle jaw, or floating deficiency yang following collapse of yuan primordial qi. So for these three different causes, you can see what's in common is the heat. No matter excess heat or deficient heat, they are heat. So that's why it only happens in the upper body because of the heat can have the characteristic of flaming up. So that's the fire characteristic. So from the head, you can imagine that the heat in the body, and because of the heat, the hottest part of the heat is in the flame, which is the higher part of the body. That's why the patient will have sweat in the head or neck. Here we also mentioned that physiologically, people with constitutional yang qi excess may sweat on the head after eating spicy food or drinking alcohols. So that's also because of the spicy food or alcohols can increase the yang qi in the body, which also goes to the head to cause the head sweating. The second is Hemi Hydrosis. This refers to sweating over half of the body, either the upper or the lower, the left side or the right side. So what happens to this Hemi Hydrosis? The location of disease is on the part of the body without sweat. This mostly happens in patients with like after stroke or paralyzed patient. It's also always caused by the disorder of qi and blood due to weak wind flange, and then the phlegm block the meridian. Intermingled stasis and the phlegm or wind dampness obstructing meridians. So for this kind of sweat, we need to understand that the affecting part is the part without sweat. The normal part will sweat. This is mostly due to, it can be wind phlegm, it also can be phlegm stasis, or other kinds of pathogen that block the meridian. Sweaty palms and soles. Physically, some people may have mild sweaty palms and soles, but sometimes it's genetic. And pathologically, the factors that contribute to excessive sweating on the palms and soles include excess heat in Yang-Mi meridian, damp heat in the middle jaw, and spleen deficiency. So in this situation, the patient may have either excess or deficiency. So from the sweating palms and soles, you can't distinguish excess situation or deficiency situation. You can use the other symptoms such as the inquiries on the coldness or hot feeling can help to distinguish the situation. And people with personalities of nervousness or sensitivities are susceptible to yin-yang disorder and sweaty palms and soles. So for this situation, for patient come to you for the sweaty palms and soles, it can be normal to them. It also can be pathological situation. So we need to distinguish in individuals. Sweaty chest or the hot area. So that means the front part of your body in the chest area have excessive sweating in the chest. This is usually seen in deficiency situation. The patient may have accompanying symptoms such as palpitation, insomnia, distending feeling in the abdomen, or diarrhea or loose stool. So as you can see from here, these are some other symptoms that's due to the heart and spleen deficiency or the heart and kidney deficiency. It depends on the other symptoms, the other manifestations apart from the sweating. The patient may have other symptoms. So for other symptoms, you will see it's the combination of spleen or the kidney. The last type of sweating is genital sweating. This refers to excessive sweating in the external genitalia and its adjacent area, and this is often caused by the damp heat in the lower jaw. The lower jaw here mostly refers to the liver and kidney, especially for liver fire and liver heat. The reason why mostly related to the liver fire or liver heat, that's because the meridian, the liver meridian, do you still remember where does the liver meridian travel? The liver meridian travels from the foot and ascends to the legs and goes around the external genitalium. So that's where the liver meridian travels. So that's also how we use the meridian for diagnosis. For diagnosis, wherever local area causes problems, you might think of the local area. So if the area happens in where the level meridian travels, we can assume that it's the level fire or level heat. That's similar in the next video. We're going to talk about the different kinds of pains, such as headache, how to differentiate different headache. It's also from the location according to the meridians. So this is the last type of sweating. If the patient have like external genitalium or its adjacent area itching or sweating, this we will think that it is caused by the damp heat. And the cold sweating, hot sweating, and yellowish sweating we have introduced before. So we are not going to repeat it here. In the next video, we are going to introduce different kinds of pains. Thank you guys.